Originally, I was a student at PTSMC. I did my last clinical rotation with one of the clinics in the company. After my experience at that outpatient clinic, I loved it and I really loved the company. And then after looking at a few different others, I felt like this was the best fit. My name's Emily and I'm a physical therapist. So a huge factor when looking for a company to start is the opportunity for mentorship and the ability to learn from your senior therapist. Different companies that I was looking at didn't really have people to refer to help you kind of get started and kick your feet off running. PTSMC definitely had that factor, that it had a lot of support and a good community. I also looked at patient care. So PTSMC definitely looks at experiences, patient care, expert opinion, and that was all stuff that I really valued as a newcoming clinician, and so those factors lined up with what I was looking for. My experience with mentorship, first word that comes to mind is just support. A lot of times coming from school, when you hear mentorship, you think there's a teacher and then there's you and you're being graded and you have to perform. Mentorship at PTSMC is a collaboration between clinicians. It is a supportive teamwork to handle complex cases or continue looking into research. It's not a teacher-student trying to pass the exam, trying to impress them type of relationship. The mentorship is a collaboration to reach a common goal to better your skills as a clinician. Working with mentorships, I had a case that was pretty complex, something I hadn't seen before. The patient had broken both shoulder blades. This is not a common thing to treat and or learn about in school. During the time, my mentor was able to come in and co-treat with me. My mentor also had not seen it, so it was a new experience for both of us. So it was nice to have that mentor to bounce back ideas back and forth, talk about what a healing time frame would look like, when we would expect this patient to heal, when we should strengthen them, creative ways to start to introduce exercises per their limitations. And I think it was a learning experience for both of us and really solidified that teamwork where we had to grab from both of our experiences to help this person. Knowing I had a mentor when starting being a physical therapist was everything to me. I didn't want to be just left out trying to figure it out on my own, not just with patient care, but even just learning documentation, billing, how to schedule patients. So having a mentor, if not one, but many within the program was exciting and kind of calmed my nerves when trying to start to become a physical therapist. When joining PTSMC, I had some confidence after being a student here. When starting with the company, they gave me the tools and resources where I felt confident to take on my own patients, build up my caseload pretty quickly. My confidence doubled, if not tripled, in my ability to assess patients, educate them, teach other clinicians, take on students. Overall, just in my own career, I felt a big shift in confidence. If you're interested in joining PTSMC, visit ptsmc.com to apply.